Hello and welcome to Cataracts for a cool cat, which is my dad. But maybe you're not my dad, so then this is just for you. But regardless, it's brought to you by Ashley Roberts, which is me. And here we go, let's learn all about cataracts. Let's start by looking at the eye. When looking at the exterior, you can see the iris and the pupil, but when you look inside, just like in optometry pictures, you can see that there is this darker portion that's called the macula, and then this part, which at the center is the optic nerve, and then around it, all those veins are one main vein and one main artery. And that's the basic structure of the eye, but let's get into more detail. So here we have the outside of the eye, the basic shape, and then the iris, along with the pupil. The first part of the eye we'll look at is the iris, which is the color of the eye, but also helps regulate light intake. All that light is going to go through this part of the eye, which is called the pupil. But before the light can get to the iris or the pupil, it has to go through the see-through exterior part of the eye called the cornea. In the back of the eye, we have the macula, which is the center of the retina, which is used to receive the light in the back of the eyeball. The retina is a thin layer of tissue, which is composed of a lot of blood vessels. And then in the very back of the eyeball, we have the optic nerve, which transfers the visual images to the brain. But when looking at cataracts, none of these are really important. What we want to look at is the lens. The lens is the part of the eye that sits behind the cornea, iris, and pupil. It's a biconvex structure that refracts and focuses light to the retina. The lens itself is composed of fibers that has a support system of two zonules on either side. These fibers are made from lens epithelium, and they move from the outside of the lens to the center, which creates a nucleus in the middle that is mostly made up of old fibers. The newest fibers, you can guess, are on the outside layers of the lens, the cortex. If a person has a cataract, the cataract is well defined as the loss of lens transparency due to clouding of the lens. So now we want to look at why does this happen and what even causes it. Abraham Spector and William Gardner found in 1981 that the oxidation of different proteins can accompany the development of a cataract. So how does one develop a cataract? Let's look at the risk factors. Yu-Chi Liu found in 2017 that some of the most common risk factors were increasing age, low educational or socioeconomic status, if you were of the female sex, particular racial or ethnic groups, and she also found that white people have a higher prevalence than do Afro-Caribbean people. Certain genetic factors can also put you at risk, along with ultraviolet B exposure, cigarette smoking, alcohol consumption, and also your diet. The consumption of carbohydrates with high glycemic index or malnutrition are risk factors in diet. Medical problems like type 2 diabetes and high blood pressure contribute to the formation of cataracts. There are also general ocular disorders that also cause cataracts. With all these risks, you're probably wondering how to protect yourself. We'll get into that later. Let's look more into the effects. In a study done in 1979, the eyes of outdoor workers and indoor workers were compared. The results showed that the sunlight was a huge contributor to cataracts. Due to the obstruction of the lens by the sunlight, a dark brown cataract was formed called a brucinate, which is specifically caused by sun exposure. Along with sunlight, cigarette smoking also forms cataracts. The effects of smoking is associated with the cataract called nuclear sclerosis, which is when the center of the eye is obstructed. But without these influences, cataracts can happen naturally. So we're going to look at who does it affect. When looking at age, cataracts do not only apply to those who are aging. In 1996, Lambert showed that out of a study of 10,000 infants, 1.2 to 6 cases had cataracts. Infants form these cataracts from either heredity or different syndromes. However, increasing age seems to be the leading cause of cataracts. In 2014, the World Health Organization estimated that there were about 95 million people visually impaired because of cataracts. The cataract risk increased with age, with 3.9% for people ages 55 to 64, and when looking at 80 years or older, it was a 92.6% higher risk. In 2004, a study was done in Australia on 3,654 people who were all over the age of 49. The results showed that late posterior subcapsular cataract caused the greatest reduction in visual activity. This cataract is located in the back of the lens and blocks the path of light. This type of cataract is also very common in diabetes. But the overall study found that people who were 60 years or older were influenced the greatest by the type of cataract that they had when it came to visual activity and function. So besides staying out of the sun and not smoking, what else can you do to protect yourself? Liu in 2017 also found that maintaining a protein intake of 100 to 150 grams a day and a vitamin C intake of approximately 135 grams a day will help patients with nutritional deficiencies. Along with an increased consumption of vegetables, along with vitamins like E, A, or B, are factors that can prevent cataracts. Protective factors against diabetic cataracts, according to Varma in 1977, is an oral administration of quercitrin, which is an inhibitor of aldose reductase, which plays a key role in the formation of lens clouding. However, if you don't want to change your lifestyle, like I'm sure my dad doesn't, then it seems like surgery is the best option. In the 1970s, cataract surgery was done by intracapsular cataract extraction, which is literally just the removal of the lens of the eye. The patient would then be given a pair of spectacles to be able to focus. However, cataract treatment has been dominated by the advances in our surgical care. And in comparison with 25 years ago, right now it's incredible. The surgery itself consists of just a small incision, most of the time using lasers to make this incision, to make an opening in the cornea. The cataract is then suctioned out and replaced with a lens replacement. The surgery takes from about 30 seconds to 3 minutes. It's very fast. Complications can occur, however, as the suction can be lost due to the patient moving, which could cause some corneal bubbles. Complications are rare, and it's very common for patients to come out with 20/20 vision. So now, with all this information, you're probably thinking, what happens if I just leave these cataracts untreated? The simple answer is that you will go blind. Because the lens can't repair itself, it needs a replacement, which surgically is very available. However, this operation is also very expensive. So I suggest, at least for my dad, to use some of that retirement money to get this cataract surgery. But if you end up not getting it, I hope you at least learned something.